Hello and welcome to another episode of Wellness. Today we focus on post-traumatic stress disorder, also known as PTSD. It is a mental disorder that is largely misunderstood. For most people, this acronym is a mystery. For those who have suffered a dramatic trauma, it is everyday life. Post-traumatic stress disorder is what the letters stand for. It is a psychological problem that others cannot necessarily detect. While it mostly affects war veterans, it can also affect people who have undergone severe traumatic experiences. What can you expect after a traumatic experience, and how can you manage stress reactions? We are joined by Professor Geoffrey Wango of the University of Nairobi, the Department of Psychology.
PTSD, or post-traumatic stress disorder, starts with trauma.
Yes.
So the first thing is perhaps understanding what is trauma. A trauma or a traumatic event is a situation or circumstance that is so intense that it is overwhelming to the person, so that the person is unable to cope with it as well as they should. In other words, in normal circumstances, when you have something disturbing you, you can cope with it. Like, let's use the most basic, when you cut your finger.
Yes.
But then a traumatic situation is much more overwhelming. Like when you have an accident. And you know there are different kinds of accidents that you can have.
Yes,
and a major disaster, for instance. Like when you describe a man-made, like an earthquake or floods. You see?
Yes.
Then you can have, that is natural. But then you can also have something man-made. Like when you have something like a chemical explosion or a bomb explosion or a major accident. So other aspects include a loss or a serious injury, like when you have an accident, and any form of abuse, physical, psychological, or sexual, emotional, yes. That can be overwhelming for the person or for the body to cope with.
Yes.
So when or a loss of a loved one, especially when you come to children.
Yes.
But even for adults, you can suffer a loss. Even in a relationship. If you have been in a relationship, say for some time, let's be moderate.
Yes.
Maybe 5-10 years, someone has given everything
Yes.
in terms of what they have to this person. And then the person sort of abandons them. It's a loss. So when the event happens, it is so intense such that the person's capabilities or brain is unable to cope. And so we say the person is traumatized. As a result of the trauma, there can be negative and positive effects.
Okay.
Let's go for the positive.
Yes.
The event can be so traumatic that the person learns or adapts ways of coping with the situation, to the extent that in the future they are able to cope with other situations. And we call that positive effect of trauma.
Yes.
But then, unfortunately, on the other hand, sometimes the situation is so intense that the person is unable to cope as best as they should. And as a result, they are traumatized as a result of the event. And then we'd say, that is why we talk about post-traumatic stress disorder. So it is stress that is so intense that the person is unable. And it can be caused by two things.
Yes.
It can be at primary level or secondary level. Primary level is when you are witness the event yourself, or you are part of it. The secondary is you may not be. The primary is actually you are part of it, like you're in an accident.
Yes.
But the secondary is you may be a victim of or associated with the event that happened.
Something that you saw.
Something that you witnessed.
Yes.
Something that has come to you as a result of several aspects.
Yes.
Like if you're a journalist, like you for instance, or a police officer, or a social worker, or a counseling psychologist, or a doctor, you witness victims of
trauma,
of events, physical or injury or whatever. So it affects you psychologically.
Without knowing.
Thank you. Without knowing. Actually, that's the worst thing about trauma.
Yes.
For many people, they are not aware that they are traumatized.
What can you expect after a traumatic experience, and how can you manage stress reaction?
I was first diagnosed in 2018 after having struggled maybe for like a year or so, not knowing exactly what was happening. Having visited several doctors, specialists from, internal organs, kidney, liver, specialist doctors, the brain, TB specialists, arthritis specialists, heart specialists, only to get diagnosed when I got to Bagathi Hospital.
Yeah. So how are you feeling, going for all these tests and nothing comes out positive?
Oh, it was very traumatizing.
Yeah.
First, it just started with a pain, on my right side of my stomach. And I went to a hospital, and the doctor requested that I should have a CT scan. And when I had a CT scan, it came to me, like, this is going to be my worst fear, what I've been fearing all through. But I didn't know that was PTSD. My biggest fear was to have terminal illness. And so this time when I got the results, I refused to go and pick the results. I called my husband to come. They would call my name, like the results are out, but I refused to go and pick the results. And I sat by the hospital restaurant for like 2 hours waiting for my husband, just because I knew the results would say that I was suffering from a kind of a cancer.
Illness. Okay.
Yeah.
Okay. Yeah.
Yeah.
Uh-huh.
And when he came, got the results, he read the results. He does not know what I'm feeling or fearing. And when we went back to the doctor and he said, I am okay, I got the relief. But when I got home, it was not over. Now, it is not the stomach. I have no any kind of cancer in my stomach, but I am still struggling. I am sick.
Yeah. How are you feeling? Is it headaches or what is this that you're feeling?
Goodness. I may not even be able to explain.
Okay.
It was just something in my mental, the fear, the anxiety, the fear of unknown. But I knew at one point I would be diagnosed with a terminal illness.
The immediate symptoms of trauma is like the normal. It's like if you can use a few incidents that have happened in Kenya, very unfortunate ones. Of course, it's like the 1998 bombing of the American embassy or the 2007 general elections. Of course, these events are traumatizing. How? The first thing that happens is that you start experiencing a lot of fear and anxiety, and of course, let's quickly add COVID. Yes, COVID must be in there.
That would also be
you wouldn't
traumatizing.
leave it there.
Yes.
This is the disaster.
Yes.
A disaster has a serious magnitude. So what happens is that people start by losing sleep. You suffer from fear and anxiety.
Yes.
Quickly, fear.
Yes.
Fear is when you fear something that is real. Anxiety is when you fear something that is not necessarily real. But in the event of a traumatic situation, it is both. You fear, and you have also anxiety. Like if you ever been bitten by a dog, you fear a dog will bite you. That's why the symptoms now start coming in, like lack of sleep. You fear. But even you're not sure what you are fearing, but there's something you are fearing, but you're not sure what it is. And you keep fearing that it will happen to you. So it develops into anxiety. And the anxiety results into anxiety disorders. And the anxiety disorders now start making the life difficult. So you see other signs like lack of sleep, lack of concentration even at work, and fear of the unknown. You see, so many people fear nothing. They fear something and nothing. And that's why you see also there is panic of news and everything.
Yes.
So all these are symptoms of post-traumatic stress disorder.
I start looking for another answer. And in the process, I start numbing my right side from the head all the way down my right arm, my leg. And I called one of my good doctors, a friend, Maxwell from Roy Family Hospital. And he asked me if I could go for an urgent CT scan for my brain. And the next day, I get the results. I don't want to pick the results. So I called my husband again.
Yes.
And he was very cooperative. He comes, Roy Family Hospital, he picks the results. And again, the doctor asked me, can you, get a JPEG and send it to me? And he says, you are okay. Please go home, you are okay.
Okay.
So I go home again. But I'm not okay.
You still don't feel okay.
I still don't feel okay.
So you don't understand what's going on.
I'm looking for an answer because deep down in me, I am sick.
The stress becomes so intense, so the person is unable to cope.
Yes.
So as the person is unable to cope, the person now goes to PTSD, post-traumatic. That's why it's called post-traumatic, because it comes after the event has happened.
Okay.
Yes.
Okay. Now, once you have diagnosed this and you have determined it's actually PTSD,
Yes.
how then do you treat it?
Now, very fast then, there are two first of all ways of coping with this.
Yes.
The first is what we do as counseling psychologists and psychiatrists, and other social workers. We tell people that the most important thing in life is to learn to handle stressful events. Always handle stressful events.
Yes.
Handle life. Life has challenges,
It does.
just the ups and downs. So the most important thing is first of all, balance it. You are stressed a bit, cope with it. How do you cope with it? Just a simple thing like taking a walk, having a hobby, taking a walk in nature. So you relax.
Yes.
You stay relaxed. So you cope with the stress.
Yes.
You see,
You
so you
relax.
don't allow it to go beyond.
Yes.
Yes. So if it is an event like a loss of someone or of a loved one, with due respect, take part in the activities so that you can now allow closure.
Yes.
That's why you tell people to attend a funeral, like a
Okay,
relative,
so you get closure.
so that you can allow the person to go. You can close it. Closure is like the way you close.
Yes.
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 And that's why we suggest that even when a child has lost someone and they're in school,
Yes.
pick them like a day before the funeral.
For the funeral.
Of course, the child is briefed well.
Yes.
Then the child participates in the funeral, and then the child goes back. So the child can close, can see the person go, and around. So that's the most basic.
It's the
In
most
fact,
basic.
before you go to PTSD,
Yes.
the first major thing about life is handle the stress.
Handle the stress.
Then we go to more stressful situations,
Yes.
such as PTSD.
PTSD.
Now this now can go a bit. It may require much more. In the worst of circumstances, it may require medical part.
Yes.
When the person is depressed
Yes.
or they have mood disorders,
Yes.
in which case they may even need to be to medication.
Yes.
But also they need therapy. Therapy, counseling, psychotherapy is almost similar, because they all mean that you need psychological treatment
Yes.
in order to go back to your normal self. What is a normal self? Let's use a more different, better word, regular, because it is never normal.
Yes.
Like if someone lost someone in the 1998 or wherever it happened, and they have experienced a traumatic situation, the situation does not go back to normal. Because when you lose someone or something, the situation does not come back to normal. What happens is that you regularize your life. You learn and unlearn and relearn to deal with this. So that's where therapy comes in.
Yes.
And that's why the most important part is the education, for people to learn that I have lost something I valued. I have lost someone who cared for me and I felt was close to me. So that the person now allows the brain to process it and let this person go. So, but in the worst of circumstances, they may need medication. Because there are people who can be so traumatized to the extent that they start hallucinating and having illusions. And the person can sort of what most people call bipolar. What people call mad people.
I could see a lot of signs of my sickness. Like every time I move from this thought that this is where I'm suffering to another thought, I start seeing signs.
Yeah.
And now I can
Happens.
see, and I read a lot. I
So
Google a lot.
you're researching.
Yes.
And these symptoms come.
Once I search,
sure.
whatever I see on the Google
Yes.
is what I see physical.
Wow.
Now I start seeing, like this kind of discharge. I'm having a lower backache.
Yeah.
And I'm just waiting for this day,
Yeah.
for the doctor to tell me that I'm suffering from cervical cancer. And 2 weeks down the line, you can imagine, I'm not eating, I'm not okay.
Yeah.
My clothes are not fitting me anymore. I've lost like almost 10 kilos now.
When you talk about this advancing, what are the repercussions of an untreated PTSD, for example?
Serious, yes, obviously there's serious repercussions. You see, this lack of sleep, for instance, for a child, it will lead to poor performance in schools,
Okay.
which of course stresses the child more and leads more pressure from the parents and the teachers for the child to perform. But you see, the brain is not performing because the brain is blocked. Remember, it experienced an event, a traumatic event. So it's sort of, you see, when the brain is sort of like a cat. You see, it has reached its capacity to cope.
Yes.
So it is not coping. So when it's not coping, it cuts off
Yeah.
everything else that's coming in. And that's why even at work, you see people, that's why we do a lot of debriefing when an event has happened to people, so that they can learn, they can get back to themselves. Like even the way we are having a conversation with you, you can have a conversation with someone, even you, who has experienced a situation. You just sit with them, tell me what happened. I was seated, then ABCD happened, ABCD this and this. At that point in time, whom did you see? What happened after that? You see, the person is talking about this. The brain starts processing it. The brain processes it. As it processes more and more, it starts regularizing it. That this event happened.
Yes.
What can I do after this? And all that. And that's why we also bring in other aspects that are very important, like prayer and meditation. Prayer and meditation is very important, so that you can calm the brain back. Here the eating and here the diet. Yes,
That's also important for PTSD.
very, very good. Very, very good. Very, very important. Another one, very, very important. Forgiveness.
Forgiveness.
Yes.
Forgive you, forgive
Yes,
who?
yes. Forgive yourself
Yes.
if you feel there is something you did or you didn't do. Notice the two. You did or you didn't do. And also forgive the person. Like quick one, when we have been discussing the 7th of August, the unfortunate event of 1988, you need to be very careful as you discuss what happened. You need to tell the person who could have been traumatized or whatever to learn to forgive those who took part in that bad act. Yes, insidious act. You learn to forgive them. Why do you want to forgive them? So that the person can start healing. Yes, when the person with PTSD is the one you need to heal, not the person who did the action. So this is the person who needs to forgive to heal, because the heart is broken, so the heart can heal. And as it heals, the person takes on into a life, and then also the person processes the events that happened, like loss of a leg or loss of a life or loss of something very precious to the person, whatever it is.
Yes.
My dad calls me,
Yes.
please come, I want to talk to you something. And he asked me in my vernacular, what happened to your body? Because dad knows me as a big body, just the way you see me.
Girl, even
Yeah,
when you're so
I'm
big.
still daddy's girl,
Yeah.
and he's very concerned. And he asked me, what happened to your body? I don't like the way you look, you know. And
Yeah.
when daddy tells you that,
It's so painful.
and he's an old dad, you know,
Yes.
he's an old mzee,
Okay.
and I really felt it.
Yes.
Yeah. May the doctor tell you many things, and many things make you very sick. And so they talk, and I think he told the lady in the Cuban language, this lady is suffering from PTSD. And that is when I was diagnosed with PTSD. And I go to Dr. Susan, and this is another journey again. And now I start now therapies. And therapy is first to want to know what are my biggest fears. What is this that I fear most?
Yes.
And I automatically say I fear terminal illness.
And you don't remember.
I
the
don't
cause could
remember.
be what you
And
experienced.
she asked me, have you ever experienced a patient of terminal illness? And I said, yes. I lost my daughter about 12 years ago.
That's a long time.
Yes, to blood cancer, leukemia. I cried a lot. I realized I hadn't processed the death of my daughter. And that is when I realized what is PTSD.
You've talked about diet, you've also talked about forgiveness.
Yes.
Are there any other lifestyle changes that maybe somebody struggling with PTSD can make to help in the healing process?
Exactly. That's a very important remark. What happens is that also it is important for the person to learn what are other things that they can do. For instance, if one is not careful and they have lost a loved one, it is important for them sometimes to remember, with due respect, what the person meant to them. Physically, psychologically, even financially, or even spiritually. We assume that anybody who experiences a traumatic event will be necessarily traumatized. It doesn't have to happen. Especially if the person has very good coping mechanisms, and if the person has a lot of resilience and positively thinks about their lives in very many ways. Of course, the negative part is that, of course, traumatic events are so intense that they can have a lot of side effects. So that's why we have a lot of misconceptions. And sometimes even when we go to people, we assume they are traumatized. Not necessarily so. Someone doesn't have to be traumatized because something happened. And the most important thing we should do is to find out what happened to them and take them at the level that they are at. Yes, they are at. And with due respect, some people may just need a break. Just a break from work, from normal life. And others regularize their life. Remember, not normal, regularize. They regularize means that they reschedule, they recapture their lives and go on, despite the circumstances. Remember, we are not saying we are changing the circumstances. We are not saying we forget. No. And those are some other misconceptions. And that's why people make a mistake and they say you will forget. How do you forget your parents died? How do you forget that you lost a child? You can't forget. So that's why we make the misconceptions. We come with statements. We come with so many ideals and ideas of our own. But they have nothing to do with the psychology of it. The psychology of it is take the person at their level and go along with them. What do they need most? Psychosocial support? That's it. Be there for them. What else can you do for them? What do they want? What do they need? How can they best be assisted? But don't come there and say, this person is traumatized, they need to be taken to a hospital. To do what?
To do what?
The person has not said they want to go to hospital. The person may not have reached those levels of intensity to the extent that they may need medical care. Of course, there are those who need medical care. But the most important thing is to go for the person and the client at their level and assist them at their level.
You now understand the effects of traumatic experiences and what to do should you or a loved one be affected. However life looks like, live every moment as if it was your last. Thank you for watching Wellness with Wanjiru. I am your host, Wanjiru Thuku. Until next time, goodbye.